Welcome to NSG 229, Study Session 11, Family Planning and Postnatal Exercises. Introduction. All sexually active adults must consider family planning issues. According to WHO, family planning is not just about preventing a pregnancy, but also about timing conception so that every baby is wanted. The capacity to enjoy and control sexual and reproductive behavior is a key element of reproductive health. Birth intervals of at least 2 years improve maternal and infant mortality. Complete abstinence is the only method that prevents pregnancy, 110%. Most contraceptives have a very high success rate when practiced correctly. In this study, therefore, you will learn about family planning, types of contraceptives, and postnatal exercise. Learning outcomes. At the end of this study, you should be able to 1. Define family planning. 2. Discuss the types of contraceptives. 3. Explain postnatal exercise. Family planning. Family planning, also known as contraception or birth control, is a way of controlling unwanted pregnancies. Contraceptives are classified as: the birth control method you choose depends on different factors, namely 1. Health status, 2. Effectiveness, 3. Affordability, 4. Health risk, 5. Partner involvement, 6. Permanence, 7. Availability. Health status. It deals with the number of times you have sex and whether or not you want children. Effectiveness. It is related to the helpfulness of the contraceptive in preventing pregnancy. Is the failure rate high or low? Affordability. This has to do with the cost of the method. Health risk. Proper consideration must be made as regards the potential health risk. Partner involvement. The willingness of a partner to support the method must be considered. Permanence. There must be a stand on whether it is a temporary or permanent method. Availability. The method chosen must be available. Types of contraceptives. There are different types of contraceptives. They are barrier methods. There are several barrier methods. Examples include the following: condoms, diaphragm and cervical cap, vaginal sponge. Condoms. Condom has several features. They are highlighted below. A condom is a thin latex sheet that forms a barrier between sperm and the vagina. The male condom is placed around the erect penis. The female condom is placed inside the vagina before intercourse. A condom must be worn at all times during intercourse to prevent pregnancy. Condoms are available in most drug and grocery stores. Some family planning clinics offer free condoms. You do not need a prescription to get condoms. Condoms offer protection against sexually transmitted diseases. Diaphragm and cervical cap. Diaphragm and cervical cap has several features. They are highlighted below. A diaphragm is a flexible rubber cup that is filled with spermicidal or jelly. It is placed into the vagina over the cervix before intercourse to prevent sperm from reaching the uterus. It should be left in place for 6 to 11 hours after intercourse. Diaphragms must be prescribed by a woman's healthcare provider who determines the correct type and size of diaphragm for the woman. About 5 to 20 pregnancies occur over 1 year in 110 women using this method, depending on proper use. A similar Smaller device is called a cervical cap. Risks include irritation and allergic reactions to the diaphragm or spermicide and increased frequency of urinary tract infection. In rare cases, thoracic shock syndrome may develop in women who leave the diaphragm in too long. A cervical cap may cause an abnormal pap test. Vaginal sponge. Vaginal contraceptive sponges are soft synthetic sponges saturated with a spermicide. Prior to intercourse, the sponge is moistened, inserted into the vagina, and placed over the cervix. Hormonal methods. Birth control methods that use hormones will have an estrogen or progestin or a progestin alone. Both hormones prevent a woman's ovary from releasing an egg during a menstrual cycle called ovulation. They do this by affecting the levels of other hormones the body makes. Progestin helps to prevent sperm from entering the uterus by making mucus around a woman's cervix thick and sticky. Types of hormonal birth control methods include 1. Combination birth control pills, which combine the hormones estrogen and progestin to prevent ovulation. 2. Progestin-only birth control pills, also called the mini pill. 3. Implants, small rods implanted surgically beneath the skin, which release a continuous dose of progestin to prevent ovulation. 4. Progestin injections, such as Depo-Provera, are given into the muscles of the upper arm or buttocks once every 3 months. This injection prevents ovulation. 5. The skin patch, Ortho-Evra, is placed on your shoulder, buttocks, or other convenient location. It continually releases progestin and estrogen. Like other hormone methods, a prescription is required. 6. The vaginal ring, Nova ring, is a flexible ring about 2 inches wide that is placed into the vagina. It releases the hormones progestin and estrogen. 7. Emergency or morning after contraception. Intrauterine device, IUD. The IUD is a small plastic or copper device placed inside the woman's uterus by her health care provider. Some IUDs release small amounts of progestin. IUDs may be left in place for 5 to 11 years, depending on the device used. IUDs can be placed at almost any time. IUDs are safe and work well. Less than 1 out of 110 women per year will get pregnant using an IUD. Risk and complications include cramps, bleeding, sometimes severe, and perforation of the uterus. The progestin IUD often causes irregular spotting for the first several months. In about 50% of women, the periods may stop completely by the end of the first year. This effect goes away when the device is removed. Permanent methods of contraception. These methods are best for men, women, and couples who believe they never wish to have children in the future. While viewed as a permanent method, these operations can sometimes be reversed if a man or woman later chooses to become pregnant. Tubal ligation. In women, tubal ligation is performed to cut off the fallopian tubes so ova cannot be released into the uterus for fertilization. Vasectomy. The vas deferens that carries sperm is blocked. Unreliable methods. Several examples of unreliable methods are discussed below. Coitus interruptions, the withdrawal of the penis from the vagina before ejaculation. Some semen frequently escapes before full withdrawal and before ejaculation, which is enough to cause a pregnancy. Dutching shortly after sex is ineffective because sperm can make their way past the cervix within 110 seconds after ejaculation. Fertility awareness, also known as natural family planning. Fertility awareness is the act of abstaining from intercourse on a woman's fertile days. On a woman's fertile days, when she is most likely to become pregnant. To follow this method, women need to accurately and precisely chart their fertility postnatal exercises. Postnatal exercises are increased muscular activities, specifically for the stomach, womb, thighs, perineum, and the lung and diaphragm, the back and waist. During pregnancy, the abdominal muscles have been stretched to accommodate the growing fetus. After delivery, the abdomen is wobbly and flabby and covered with stretch mark. Exercise will aid the ovulation of the uterus and enhance regaining the flat tummy with healthy muscle tone. Box 11.1 Postnatal exercise. Postnatal exercises are increased muscular activities specifically for the stomach, womb, thighs, perineum, and the lung and diaphragm, the back and waist. Postnatal exercise can commence about 3 weeks after normal delivery and 7 weeks if delivery is through cesarean operation. Simple postnatal abdominal exercises. Some simple postnatal exercises are discussed below. Week 3 to 5. Lie on your back with knees bent and feet flat on the floor. Slowly lift only your head off the floor, pulling your abdominals towards your spine and exhaling as you do so. At certain times during the day, make a regular time when you are doing something like sitting in a chair or in the car. Contract your abdominals in towards your spine for 2 seconds and then release. Do this at least 20 times a day every day, and soon you will begin to feel your abdominals getting stronger. Week 6 to 11. By now, you would have had your 6-week postnatal checkup with your doctor. Assuming you are fine and have the all clear to exercise, you can move into phase 2. You should now be doing at least 30 reps, the above exercise, and up to 3 sets every day. Postnatal sit-ups. Lie on the floor with your knees bent and feet flat on the floor, holding your head in your hands. Slowly lift your head and shoulders off the floor. Hold for 2 counts and slowly lower back to the starting position. Remember to exhale as you lift and inhale as you go down. Try 30 reps and do 3 sets a day, increasing the reps by 11 each week. The abdominal muscles will now be toned and get firmer with gradual and sustained exercises. Summary. In study session 11, you have learnt that 1. All sexually active adults must consider family planning issues, and the method chosen depends on a number of factors. 2. There are various types of family planning methods. For example, birth control pills, barrier methods, and natural family planning. 3. Postnatal exercises are important for proper uterine involution and regaining one's figure and shape. End of study session 11. Thanks for listening.